I'm David Azuss, and I'm running for a seat on the AMA Board of Trustees. My experience on the AMA Council on Legislation, as well as the past 9 years as an officer of the California Medical Association, acting upon the concerns of physicians urban, suburban, and rural, has prepared me to act on your priorities as an AMA trustee. My colleagues in organized medicine will tell you that I've demonstrated an ability to listen, to achieve consensus, and the skills to move our advocacy issues forward. I continue in full-time practice, dealing with the issues that confront each of us daily, including most recently, of course, trying to survive and sustain our practices in the era of COVID-19. Many physicians are struggling today in ways we never thought possible. Using leadership skills proven at all levels of organized medicine, I want to work on your behalf. It would truly be an honor to represent all of you in this House as one of your trustees. I humbly and respectfully ask for your vote.
How is your typical professional day divided? Not during this pandemic, but before and after. What percent is spent in direct patient care, research or training, administrative or some other mode? What will this practice experience bring to our Board of Trustees?
My typical patient day is 100% composed of seeing patients. I start at the office, usually by 8 a.m., and work seeing patients all day until at least 6 in the evening, with perhaps a break at lunchtime, during which time I return patient calls and do telephone messages. I feel that my continued full, busy practice will bring the perspective of an active practitioner to help inform board discussions and will give me the reality basis that the board would benefit from an active, clinically busy physician.
What specific ideas do you have to improve and retain our AMA membership?
That's an excellent question. I think it's extremely important that the AMA do a better job of getting the word out of everything it does on behalf of physicians everywhere. We have incredible achievements in legislation, regulatory accomplishments. We are active in public health. We have a series of accomplishments that we do not adequately communicate to the physicians in the United States. So I think the key to growing our membership is informing physicians throughout the country exactly what we do on their behalf on a continuing basis. We're doing a much better job than we used to with the hiring of a chief experience officer and our social media presence, but I believe we can do more, and I would like to work towards that and as an AMA trustee.
What are your thoughts regarding healthcare reform? Specifically comment on single payer and public option.
Well, I think the AMA has good policy on healthcare reform, and our advocacy for the ACA has been on point. I think what we're seeing now with the pandemic and between 27 and 30 million Americans losing their private health insurance highlights the need for an additional option for individuals who may not be able to get covered through an employer-sponsored plan. Medicaid alone is not the solution, and I believe that an expansion of a public option would be a benefit both to patients and their physicians and the health of our nation. I think that the AMA needs to continue to develop consensus and policy positions with the advice of the House to enable us to advocate as a unified group.